We talk about 4 stages of sleep and parasomnias, which are abnormal behaviors or emotions during sleep. Almost half of population experiences sleep-related issues from time to time, and around 15% experiences regular sleep problems.
Let's say 5 most important functions of sleep. First, memories are formed during sleep. Brain stores useful information as a memory, while it filters non-important information. Second, our emotions are managed during sleep. For example, painful memories are detached from emotions. That's why, after good sleep, a person feels better even after a very stressful day.
Third, waste products are removed from the brain. For example, beta-amyloid proteins, which are cleared during sleep. If these proteins accumulate in the brain, it causes Alzheimer's disease. Fourth, recovery and growth happens during sleep. In deep sleep stage, growth hormone is released, which is crucial for children's growth and for adults' tissue repair after damage. And fifth, immune system activation. During sleep, cytokines are produced, which are crucial fighting infection. Generally, cytokines also are produced during the awake stage, but some of them are produced exclusively during sleep. Also, T lymphocytes, which fight infections and cancers, are activated during sleep.
We sleep as cycles. Each sleep cycle lasts around 90 minutes. To describe simple, we start with light sleep. It becomes deeper, and light sleep again, and their alternations. Every night we experience around 4 to 6 such sleep cycles. Each cycle consists of 4 stages. The first stage is the transition between wakefulness and sleep. It is when a person is dozing off but waking on noise. At this stage, muscles start to relax, but sometimes misfire in the nervous system happens and it causes sudden contractions, and we call it hypnic jerks. This stage is when a person is asleep while watching TV, but when you ask if he is still awake, he answers he is watching TV. Stage 1 happens several times during sleep. Stage 1 occurs briefly at the start of each cycle. Dreams can occur during stage 1, but they are usually short, fragmented, and not vivid compared to REM sleep stage dreams. The second stage comes after stage 1. It lasts around 10 to 25 minutes. Its duration increases as night progresses. 50% of our sleep is second stage. In this stage, person consolidates memory, what was learned during the day. Person sleeps despite noise in external environment. At this stage, talking during sleep can happen. Person may speak whole complex sentences, but also simple mumbling sounds. It may happen during 4th stage, but more common in 2nd stage of sleep. Stress and sleep deprivation may trigger it. The mechanism is partial arousal of the speech mechanisms, while the individual still remains at the 3rd stage, deep sleep stage, and is considered one of the most important part of the sleep. It is physical repair and immune system boosting stage. And when we say sleep improves immune system function, it is not just words. For example, people who sleep less than 6 hours per night have 4 times more risk to get cold compared to people who sleep more than 7 hours per night. Deep sleep is crucial for long-term memory formation also. Third phase lasts around 20 to 40 minutes per cycle, but its duration lessens as night.
Third stage is important also because night terrors happens in this stage. It happens because generally in third stage brain is less active and more focused on physical restoration. But sometimes brain comes in arousal state and partially awaken. And at this time person feels intense fear, screaming and thrashing, but person is unaware of the episode and no memory when waking up. In other words, there's overactivation of autonomous nervous system. Night terrors are more common in children when nervous system is not fully developed and misfire of nervous system happens in transition between sleep stage. When deep sleep transits into REM sleep stage, which is the 4th stage, night terrors can happen due to sleep deprivation, stress or fever. Also in children. Usually it doesn't require treatment. Loud dose benzodiazepines or antidepressants are used in severe and frequent cases. In third stage also happens sleepwalking, called somnambulism. It is walking or moving around while person still sleep and unaware. It also can be triggered by stress, sleep deprivation or alcohol. In this case, decision-making centers, frontal cortex, remains passive, while motor centers active. That's why person moves but not aware.
Usually person gets up and walks around room or house, their movement usually clumsy and purposeless. It is possible person does some automatic actions like open door or window or eat or rearrange objects. Sleepwalkers usually have emotionless, blank stare and do not respond to conversations or stimuli in meaningful way. Sleepwalkers may mumble or speak nonsensical words but not meaningful dialogue with someone. In many cases, sleepwalker returns to bed without memory of the event, or asleep in other areas. For example, on floor or couch, dangerous activities are possible but rare. For example, leaving the house, really, they can become aggressive if someone tries to awake. Occasional mild sleepwalking in children doesn't require any specific treatment. In severe cases, lock doors and windows. Remove sharp objects. Use safety gates. Improve sleep, hygiene, avoid sleep deprivation. Yoga, meditation, and deep breathing also helps. Scheduled awakenings are effective 15 to 20 minutes before typical sleepwalking episodes. In benzodiazepines like clonazepam, which reduces sleep arousals, antidepressants if stress or mood disorder is a trigger.
And fourth stage is REM sleep, called rapid eye movement sleep. At this stage, brain becomes highly active while body remains mostly paralyzed. During REM sleep, amygdala is activated and it helps process emotions. Also, hippocampus plays a role in consolidating emotional and episodic memories. Most vivid dreams occur during REM stage because visual cortex and limbic system is activated. Dreams are more emotional and creative at this stage, although we see dreams in other stages also. REM sleep helps reduce stress hormone cortisol level, which helps recover from daily stress. When you awake calmer from the stressful day, REM sleep is responsible for it. Making strange sounds. Prolonged droning sounds during exhalation happens usually at this stage or during late sleep phases. Exact mechanism is not known, but associated with dysregulation of the autonomic nervous system. It also doesn't require treatment in most cases. Also, sleep paralysis happens at this stage. It is transition between wakefulness and REM sleep. Fern, person becomes aware but remains unable to move or speak due to natural paralysis that occurs in REM sleep. It can be associated with hallucinations, like feeling a presence in the room or pressure on the chest. This creates fear, panic, or feel of impending doom or danger, but is typically harmless. Nightmares like sleep paralysis, because at this case also can be intensive fear of feeling choking or unable to run. But when you wake up, you fully awake and can move immediately, different from sleep paralysis.